Pradeep, hi, welcome back to Healthcare Unblocked 2018. It's great to have you back with us.
It's good to be back. Thank
and
you for having
lovely to chat
us.
to you. It's been quite a while since I saw you, so can you give us a bit of an update, first of all, on what's been happening with Solve.Care since we saw you 6 months ago?
Well, we've been very busy. A lot has happened since we last met. The product has been released in the market. We're very excited about the fact that physicians are using our care wallets to receive real payments from their insurance payers. So that's a huge deal in the US.
Very exciting, yeah.
And they are using the care coin to get paid. So our whole vision of digital currency paid through a care wallet is working in reality. So we're very excited about that. And there's a lot of upside to it. A few hundred physicians are using it now, and then several thousand will adopt over the next year or so. We have just launched the patient wallet, as we call the family wallet, and that hit the App Store last week. So that's really exciting as well.
So people can already go there now and download your app in the App Store?
Yes, they can. So Care Wallet for physician, if you're a doctor, and Care Wallet for family, if you're someone who needs to manage their healthcare. We've launched it initially with invitation codes that Arizona Care Network, our client, issues. And then in a few weeks' time, we'll remove that limitation. So then anyone in the world can download the wallet and use it. So we're very excited about that because we are introducing some very interesting care cards in this wallet. And I'll talk about that later if you have time.
Fantastic. Well, congratulations on your progress, first of all. I know one of the hardest things in healthcare is getting change and making blockchain real. So it's great to see how much progress you've made so far. And I guess for the people that might be learning about Solve.Care for the first time, can you just explain why it was that you chose to use blockchain technology for your platform? What is it about blockchain that makes it suited to what you're trying to do within the healthcare system?
So our vision and mission has always been very clear. We want to enable the patient, doctor, administrator coordination and communication much more efficient. And instead of trying to get the systems to talk to each other, we want to have people talk to each other.
Because data's sort of in silos right now, isn't it?
Right.
You've kind of got the patient there, the doctor, then the hospital or the provider, and so it's very hard for everybody to know what's going on. There's sort of paperwork and admin and bureaucracy that goes on. So you're trying to kind of speed that up and improve the way that flows using blockchain?
Yes, I think there are three key goals. There is first to improve the outcome of healthcare. So people get well, not just go through the process of getting treated, but they get well sooner, faster, and more effectively. So that's the outcome management. The second is around they should have access to care, the timely access to the care that you need and deserve at the right time. And the third is around administrating that care. So we are actually being charged and paying for the right services, medical necessity managed against utilization. So these three pillars are today done through a combination of really complex back-end systems that, because they are very complex, are very rigid. So modifying a complex eligibility or enrollment or member management or disease management system today is a multi-million-dollar effort. And therefore, you don't do many of the things that you want to do as an insurance company, as an employer, as a NHS. You're always bound to the system capability. So the vision is that let the system not be the barrier to implementing creative care models like diabetes care or accountable care or mental health management, juvenile homelessness. There are so many specific programs that need and can work if we allow them to be more people-centric. So that's the vision. So blockchain happened to be the technology at the right place at the right time for us. We didn't really start with blockchain looking to build something on it. We started with a real problem, a very significant global problem. And we started to ask the question, how would we do this better? And then along comes the technology, blockchain is DLT. And then we realized that this may be the first time where the impossible becomes probable, where previously impossible workflows can now be reimagined and made patient-centric. So blockchain happens to be the framework. And I often get asked this question, could you do it without blockchain? Well, of course, the world existed before it. So we did have healthcare before blockchain, but it's not as efficient as we can do it with blockchain. So I see real opportunities in addressing these three pillars of access, outcome, and administration/payments with blockchain than without it. And we see that already. I mean, our doctors who are using the wallet are not waiting 90 days to get paid. They're getting paid in 90 seconds. And to them, that's a big deal.
That's a huge efficiency and cost saving. So you've got blockchain as this kind of base layer, if you like, the sort of infrastructure layer to build the platform on. And then you can obviously do many things with that. But can you also explain a bit about the Solve token? Because some people might not think cryptocurrency has anything to do with healthcare systems. So people think of cryptocurrency as Bitcoin or as something sort of more speculative. So how could we use a token within the healthcare system? What's the function and how does it work?
So first of all, any digital token, and Solve token in particular, is programmable money, which means that we are making money intelligent. And in healthcare, that has profound implications, because a dollar or a euro is dumb. It doesn't ask questions who's transferring whom and for what purpose. But in healthcare, because payments are not simple transactions, payments require third-party adjudication and medical necessity review, and typically you don't pay the doctor 100%. NHS or your insurance company pays a big part of the bill. So you have a triangle. It's not just consumer and service provider. There's always a third party that's writing the check. So it becomes very complex immediately. And if you can program the money to do the right thing, then we can take all the complexity out of the back-end system and allow processes to be much more decentralized, which means I as a patient can do a lot more than I could before. I don't need to have a policeman between me and my doctor, which is the insurance company or NHS or my employer or whoever. So programmable money is the fundamental value. Now, Solve token is the currency of our platform. On our platform, you can stand up different networks. You can stand up a diabetes care network, a pregnancy care network. You can stand up a network for all the employees of a multinational company. You can stand up a network for all the members of a big insurance company. You could take regions of NHS and say, for each of the regions and provinces, we'll have a network for that province. So those networks are sponsored by someone. And for that network, you have to manage the participation of the member, the doctor, the pharmacist in that network. But ultimately, all these networks need to talk to each other. So Solve is the common currency across our platform. So whether you are with insurance company A or insurance company B, or pharmacies C and lab D, that ability to transact between them as you move your programs and your plans, that's what Solve token gives us.
So it's really frictionless then. It's like allowing a kind of interoperability, if you like, between these different systems in terms of the payment network.
It's financial interoperability across all the healthcare networks. And we have launched one network for Arizona Care Network. We've launched Solve.Care's own network. We will launch dozens more. The common currency across all of them is a Solve token.
Yeah, and so how do the physicians find using it? Because you said you launched your care wallet for physicians. So what kind of feedback do you get from the doctors using it in the US? Because this is the first time that a cryptocurrency or a digital currency has been used for value-based payments in the US, I think, as far as I know. So what do they think about it? And what does your client, the Arizona Care Network, say about how it's going?
So we're very excited about and we're very pleased with the acceptance and the feedback. And we are learning from it as well. But overall, the physicians like the real-time nature of it. They like the transparency of it. They like the fact that they control redemption, not someone else. They no longer have to hear about the check is in the mail. It's your coins are in your wallet instantly.
So they know exactly when they're going to get paid. Precisely. They get paid more quickly, and
how much. They know the transparency of when and why and how much. And more importantly, they actually even know how they can earn more. So they also know what they didn't earn. Coins they could have earned if they had done certain things, like when Pradeep came as a patient, the doctor didn't do my A1C test. If they had done it, they would have gotten $40 more. And it was pre-authorized care, but they just didn't do it. So it actually gives them a chance to maximize revenue. So they love that, right? Because they're delivering better care, they're getting paid more, and they're getting paid in real time. What's there not to like?
It's hard to argue with getting paid more. I think all of us can agree with that.
Exactly.
And in terms of your clients, they've been, I guess, a pioneer in terms of trailblazing this project. So how do they feel now that it's out there in the wild, in the real world?
So first is that they're happy that we met the deadline. They had set a very aggressive deadline for us that we must have the wallets in production and actually redemptions happening with doctors by October 15th. And we only signed the contract with them in late December. So we had a 10-month window to go from contract to fully running system that had to be compliant with all the appropriate laws. So we worked really hard to get them into production. So we're very happy with that. And we happen to be doing this token sale along the way as well. So it was a very busy year for us. But we met the target. They went live on time. The doctors are redeeming as we speak. So we're very proud of that. So they're a referenceable client. That's the most important thing. That's ultimately the thing that we care about. Then we launched our patient wallet, which they're working with us. And that's really exciting. So they're looking ahead with us on what other capabilities or care cards we should launch in our wallets.
Yeah. So I'm interested in the patient side. So how do you think patients will get to know about this idea of using their own healthcare data? Because it's a quite difficult concept for many people to get their heads around, just the idea of owning your own healthcare data, even though they might want to, but they're not familiar with doing it. So how do you think people will respond to that? And how can we expand the number of people who might want to start using that?
So our vision of launching care wallets in the market is that they are sponsored. So we are not looking at voluntary adoption. We are looking at sponsored adoption.
Okay, so it's not the general public, any
Right.
person. I mean, they could go and get it if they want
Absolutely.
to, but you're not driving it that way.
Yeah, the voluntary adoption will occur. But what we are really saying is, let's say that you run an insurance company and you adopt our platform and you have 1 million paying members of your insurance product. What you are going to do with our wallet is issue the wallet to all million members and say, look, from now on, I'm not mailing you a plastic identification card. I'm not sending you paper mail. I'm not letting you call my call center for all the mundane things that you call me about. I'm going to give you extraordinary power in the wallet to do things you always wanted to do, but you have to use the wallet. So this is a carrot and a stick model. So a sponsored wallet is paid for by someone, the sponsor. I, as a consumer, am getting the benefit of the wallet. And if it's easy to use, it's far more efficient than it's naturally top-down adoption. So we see really no barriers to adoption other than a well-designed program.
Yeah.
So if I give you value, you will use it. But I'm not going to rely upon voluntary adoption. We are very much focused on B2B client, our business clients, driving adoption through their constituents.
Yeah, I think that's a very clever strategy, because that way you do have a larger user base, but they're sort of invested in using the system rather than having to go and find it in a sea of other apps and products that might be out there, and the noise is too high for people to find your product.
And then on the other side, even though I may get a wallet from my sponsor, let's say my employer, Solve.Care decides to issue care wallets to all its employees and pays for them. I, as an employee, now have a unique benefit. But then later on I change companies and I go work for another company. I don't have to give up my wallet, because that wallet can still connect with a pharmacy wallet network. It can still connect to my therapy network and so on. So we are basically decentralizing healthcare delivery, which means I, through single wallet, can connect with any insurance company, any employer, any pharmacy. And that's the ultimate vision, that wallet is mine, the network is yours, and I will register my wallet on your network if I see value.
Yeah, and the applications within that are vast, aren't they? Because you talked already about, something you're doing with physicians, helping them to get paid faster and have a more transparent financial transaction, but also it could be used from the patient side, let's say, to cut down the cost of their medical transportation or some other elements that are not necessarily directly related to care, but there are all these ancillary services that go around care that could be brought into your platform, as well as things that can be built on top.
Yep, absolutely. One of the really exciting capabilities in the family wallet that we have launched is the ability to take care of and monitor the health and wellness of people we love. So my mom lives away from me. She is up in Washington, D.C. I'm in Florida. So I call her every day and ask her, how are you doing? And she goes, I'm fine, which is a meaningless answer, because I don't know if she's really fine. And I don't know if she's progressing or regressing in her health conditions. So what we built is, in the first version of the wallet that we have in the App Store, is my ability to sponsor a card called How Are You Feeling Today? That actually requires her to answer specific questions. Now, she has osteoporosis. So in consultation with her doctor, I can specifically ask her 5 questions a day. Do you have any nausea? Did you wake up with any severe back pain? Do you have any numbness in your arms, your legs? Are you losing weight? Are you having any kind of a sleeplessness? If she answers those questions every day, it creates a care ledger, which can be shared with me and or with her physician, which I can sponsor all that activity from my wallet. Yeah. So now if she doesn't fill it out, my wallet knocks on her wallet saying, knock, knock, Pradeep's asking you to fill this. That's the best way to get people engaged. If my daughter were to knock on my wallet,
accountability partner in a way. Yeah.
Exactly. The people we care about, I will not ignore a knock from my daughter on my wallet saying, Dad, how are your allergies? Which she literally calls me every morning and says, how are your allergies?
Yeah.
So instead of me saying, I'm fine, I actually answer the questions through Care, how are you feeling today? Now all that, what it means is that I now have a record that can be easily and confidentially shared with a doctor, an allergist, family members, and we can take action such as sending her a transportation card to my mom if we see a regressive behavior, so she gets an automatic appointment, an automatic ride share appointment, link to the appointment. She doesn't have to worry about the copay. I'm handling all that for her, and she just needs to show up. So it's this care coordination of our parents, our children, when we are away from them.
Yeah.
That's our first big use case. We're
I think
launching
that's
that.
such a great way to get people interested as well, because we've all got an elderly relative
Yep.
or a child with an illness or a friend or somebody else that we want to keep tabs on. And we live in a world where we often are very far away from the people that we care about, and we
Yeah.
can't also transfer value to them easily within the healthcare system. But if we can do it through your platform, then you can see that there's many, many kind of emotional and personal kind of benefits to that as well, which I find
Absolutely.
really interesting for society as a whole. I mean, even beyond just what we're talking about in this event today about blockchain and healthcare, but what's the greater impact on how we kind of interact with our families. It's another way of doing so, which is not currently there. So I think that's really, really interesting.
Yeah, I think there are so many use cases here around this sort of a wallet-to-wallet capability. Just taking that concept one further, in some of the fast-developing Asian nations, there is a split between rural and urban, and parents end up living in rural area. Kids move to urban area to find jobs and lives, but you have a high rate of suicide caused by loneliness and depression,
Sadly, yeah.
of people who feel neglected and left behind. We need to re-engage through a more meaningful than text messages and phone calls, which are not regular and they're not reliable,
Yeah.
and create this care coordination without me having to be physically in the village. So there are so many applications around diabetes, mental health, chronic disease management, pregnancy management, that we are launching many, many such programs.
Yeah.
But the foundation is what I just described.
And so you go around the world a lot. I mean, you've been to many conferences since the last time I saw you, in the Middle East, in Asia, in the US, in Europe. Do you find that people respond differently to your project in different parts of the world? What kind of feedback do you get from different places?
So when we talk about, the humanity, our need to take care of ourselves, our families, our parents, our children, there is complete alignment there. We all have the same issues, regardless of whether in Saudi Arabia or in Sudan or in Singapore. It makes no difference. So as we describe the use of our platform to actually manage care and disease and wellness, we get instant recognition and really strong response. The administrative side is different. The way we administer healthcare in the US is markedly different than how it's administered in Nigeria. So the three legs I talked about: access to care, everybody gets that. Outcome-based care, everybody gets that. Administrative care is very regionalized. So we try to make sure that people understand that regardless of the healthcare system they are in, the human element of healthcare is very common. So these cases like diabetes management, how are you feeling today card, those have universal appeal. We get very strong reaction.
Yeah.
So we just tailor the message based on the audience, but generally speaking, we get very much wow, this makes too much sense. How come nobody's done it before?
Yeah, and so currently you're focused in the US in terms of your existing client, but do you have plans to expand beyond the US market into other places? You already talked about some global things that you're working on.
So we will be launching our care cards next year in a much more global basis. Clearly, we have big clients in the US that we are working with, ones that we have announced and ones we haven't. So we have a huge traction going on, but it's not limited to US. The administrative side is very US-centric because that's where the big expense and cost is today. But on the clinical and the outcome side, we are going global. So we expect that in the next 2 years, we'll have our wallets around the world. And we want to make sure that we can deliver value to each country. So there's localization, language, cultural customization we have to do, but we see no constraints whatsoever.
And so in a year's time, hopefully we'll see you back at Healthcare Unblocked 2019. What do you
Indeed.
think will have changed for Solve.Care in the next year, if you had your crystal ball that you could see the future?
So I think that staying conservative, we would expect to have 3 or 4 significant care management programs, either around diabetes or substance abuse, mental health, clinical and loneliness and clinical depression, cardiovascular disease, or pharmacy compliance. Those programs we will see in various stages of success and deployment. I would hope that we will be able to measure the number of care wallets in the market into hundreds of thousands, if not over 1 million wallets. Our target is to get 1 million wallets out in the market next year. We see a pathway to it. It's all about execution now. So I think we will see a number of different programs that people can relate to. We'll see a number of care networks that are sponsored by insurers or pharmaceutical companies or therapy and other care provider-specific networks. And then we'll see quite a bit of wallet adoption because there's such tangible value. And yeah, I look forward to being here next year.
Well, I look forward to it very much. It's been fascinating talking with you. I hope we will get you back next year. I hope you will not look more tired because you've got so much work to do over the next year. So you'll have to make sure you look after your own health as well. But
absolutely,
you can have one of your relatives to knock on your wallet to remind you.
My daughter's doing that very well.
Great to see you again,
Pradeep. Great to see you again.
Thank you so much for a great conversation.
Oh, it's always a pleasure to be here. Thank you.
Thank you.